Doctor, how does diet and lifestyle play a role then into someone becoming obese?
So when you look at diet and lifestyle, or diet and exercise, diet definitely contributes more to your weight than exercise. Certainly, part of a healthy lifestyle is having routine, frequent exercise and activity within your life, but wanting to lose weight, and diet is going to be more contributory to losing weight than exercise alone.
And doctor, let's talk about other major health concerns that can happen if one is obese. What are the most dangerous? I know there's many, but can you list some of them for us? That would be maybe the top three.
Sure. So I would say cardiovascular disease, diabetes, and hypertension.
All right. And how do those develop over time? What happens?
So your body develops what is called insulin resistance with the excess adiposity that's carried with obesity, and your body starts losing the normal ability to metabolize and utilize glucose within your blood sugar. And ultimately, the disease of type 2 diabetes can and will develop over time. And diabetes as well as obesity can contribute to both cardiovascular disease as well as hypertension. Obesity is an inflammatory state, and so the way that your body, again, metabolizes glucose, deposits plaque, chronic stress of hypertension on your blood vessels can all contribute.
And doctor, since we're talking about childhood obesity, I'd like to go to a new video from the World Obesity Federation that talks to children and young adults about this disease. This is really important. Let's take a look. Doctor, looking at that, I was really happy to see the awareness. And I think that's something that we need more of when it comes to obesity. I just don't think it's at the forefront, especially with younger kids, teenagers, younger adults.
I couldn't agree with you more. I really appreciate that video, and particularly the highlight of the lack of control that individuals actually have around the factors around them. And we as a society need to help.
We really do. I want to go to a question now. We have a question from a viewer, and his name is Keith. My doctor wants me to get bariatric surgery, but I'm afraid to do it. What are the risks involved? And will I have a lot of loose skin afterwards? Doctor, before we answer Keith's question, can you first explain what bariatric surgery is for our viewers and then chime in on what his concern is, please?
Sure. So bariatric surgery is typically performed in the United States minimally invasively or laparoscopically. So we do the surgery through very small incisions, usually 5 or 6 incisions. And typically there are two of the most common. One is a sleeve gastrectomy and the other one is a gastric bypass. In a sleeve gastrectomy, we remove around 80 to 85% of the volume of the stomach and we remove it permanently. And that's considered to be a restrictive procedure, which means you can eat less volume. That's a more simplified answer than what's really going on. It also affects the hormonal response to eating as well as your metabolism, which is probably the more important effect on your weight. The other procedure is called a gastric bypass. In this procedure, we take the normal stomach and we make it into a small pouch. And then we divide the intestines and bring them to a small pouch. So that when you eat food, it goes down your esophagus into the very small pouch, and then it travels immediately into the intestine. It bypasses the digestive enzymes that are secreted into the small bowel from the pancreas as well as the gallbladder. And with this procedure, it's considered to be restrictive as well as malabsorptive. So the diet that you are eating, not as much of it is being actively absorbed. It also has a very strong hormonal or metabolic effect on your body.
And to answer Keith's question, he asks, will I have a lot of loose skin afterwards? What is your response there? I hear that from a lot of people too, that they worry about that.
So this is a great question. Many of my patients ask this exact same question. And the answer is you may have loose skin. There are patients who lose up to 60 to 70% on average of their excess body weight, and the result can be loose skin. The response to that, to completely treat it, is plastic surgery to remove the skin. But the ultimate decision whether or not you need surgery is very much a personal one. And I have many, many patients who have large amounts of loose skin that have no desire to have additional surgery. Many patients don't have as much loose skin. Typically younger women that have a little bit more elasticity within their skin sometimes have less of the loose skin. Some patients have a very small amount that bothers them and they choose to have surgery to address it. Again, it's a personal decision whether or not you want to address what loose skin you have. But I ask my patients when they're a year outside of surgery if they have any regrets or if there was anything they wish they would have done otherwise, knowing what they know now. And 90% of them say to me they wish they would have done surgeries too.
Look at that. Speaking of surgery, doctor, we have a question from Sasha from YouTube, and here it is. Hi, guys. I was wondering if you could tell me about minimally invasive surgery through the belly button. Is there a lot of pain? Does your belly button hurt, feel the same after the procedure, look the same? Great questions.
So there are 2 different types of minimally invasive surgery that can be performed. One of them is called laparoscopic surgery, and one of them is robotic surgery. We don't typically do single site, so just through the umbilicus, laparoscopic surgery or really robotic surgery. We typically use multiple small incisions. And when I say small, they're usually between 0.5 centimeter to about 1.2 centimeters in size. And these little incisions, some of them that are larger, so 1.2 centimeters, end up getting closed with stitches well underneath the skin, deeper in the muscular layer. They can be tender when they're healing, but once the tissue is completely healed and the skin is closed, they can be hardly noticeable, whether it be hidden within your belly button or in other locations around your abdomen.
All right, just to remind our viewers, if you have a question for our expert here on Dr. Q&A, you can email us that question. Send your questions to questions@allhealthtv.com. Give us a call at 855-796-4475, or you can go straight through our website, which is there to your right, lower right-hand side, allhealthtv.com. Doctor, I know one of your passions is working with obese women who hope to get pregnant, which I think is wonderful. First, tell me about your passion and how you help them and why it's difficult for them to get pregnant. Lots of questions there. My apologies.
It's okay. This is definitely a topic that I enjoy talking about. I myself am a mother, and actually just recently gave birth to our fourth son. So we have an 8-week-old at home right now, and I absolutely love the ability to be a mother. And there is nothing more satisfying in my job than being able to help other women that would like to achieve this goal. So many women that have obesity also have what is called PCOS, or polycystic ovarian syndrome. And that's a disease that's related to abnormal hormonal responses that can contribute to infertility. And bariatric surgery is one of the best and really only cures for PCOS. And so women that have undergone bariatric surgery have significant increases in their fertility. So up to 70% of women that were not having normal periods before surgery can start developing normal periods. And I can tell you of many patients of mine who struggled to become pregnant before surgery and have gone on to have very healthy and satisfying pregnancies. I'm very blessed when patients send birth announcements, make a special trip to let me know their exciting news.
Oh, that's so fantastic, Doctor.